My name is Martin Griffiths. I've got lots of hats and titles, but I'm here to share with you a couple of things. I want to share with you my journey to working with St Giles, what I think St Giles stands for, and what it means to me. So I was thinking about this. I've got caught up in how I feel. How am I going to talk? How am I going to talk about? I thought I'll start off by just talking about the journey I met with St Giles, and I think it'll be useful. But and I couldn't work out how to phrase it. Then, funnily enough, over coffee this morning, a friend of mine asked me, "How did you get these guys working on the ward doing this? And what do they do? Because they've been here forever." And the story's quite interesting. For those who don't know what I do for a living, I'm a trained sort of trauma surgeon, and that's what I do for a living. I work in a major trauma centre, looking after the victims of interpersonal injury, stabbing, shootings, car stuff like that. And I've been doing it for far too long. And the thing about the work that I do is I see the most vulnerable people in the worst time of their life. So I see young people, and the average age of our victims is 16. Most common age we see 16-year-olds. Second most common age is 15-year-olds. With minor or major injuries. Some of them live, some of them die. They're all traumatized, as are their families, as are their communities. And I've been seeing it day in, day out for as long as I've been a surgeon. So I've got a very skewed view on violence. I live in the East End, I work in the East End, I look after young people who've been shot and stabbed, and they are amazing young people who are hugely vulnerable, who have no faith in the system, no trust in the system, and no reason to trust the system. And they come back to me being re-injured and re-injured and re-injured. And I'll see them either on the ward, or I'll see them in court when they've hurt somebody else, or I'll see them in the coroner's court when they've been killed, or I'll see them in the mortuary. And I talk with their parents and their families and their loved ones about what's happened, how we do it. And for years, I tried to help. I tried to be the voice of reason, the voice of understanding, the voice of compassion, the angry voice, the shouty voice, the directing voice, and nothing seemed to work. And I thought to myself, how do I get this to stop happening? How do I get these young people to understand that I care and love them? And I want them to see what they can be. And at this point in their life, this point in injury can be something fantastic, but I didn't have the leverage. I didn't have the voice. I didn't have the resonance. I didn't have the trust. I was ruminating on this, and I went off around the world, and I did pieces and met people and did something like that, and it was all very fascinating, but I couldn't get it right. And at some weird policing conference, I bumped into a guy you might know called Evan Jones, who works with you. He's in here somewhere, I'm sure. And we had a chat about how we could do care, how we could support young people, about wraparound care. I'd seen some work in America about people with lived experience supporting young people in the clinical environment. And I knew that St Giles were really effective in the community, looking after people who've been in and out of the criminal justice system. And, they were a really powerful group who could actually listen and support people who were challenged and challenging and vulnerable and needed support in true ways that were actually really effective. We concocted this harebrained scheme to bring this sort of work to the healthcare environment. Now, don't get me wrong, guys. Like, this is a really impressive, lovely, big £1 billion box with a helicopter on top of it, and we are a highly effective, very proud, very arrogant healthcare system. We don't let anybody into the building unless you've been stabbed. We don't let staff in. We've all got degrees, we've all got publications. We're all very, very senior. So the thought of bringing in people who aren't like that was a bit of a mission. So Evan and I concocted this great plan, which didn't pass muster at all. And they just laughed, not even laughed. They sort of looked at me like I was absolutely insane. And we got funding to put down this piece of work. And Evan introduced me to some two caseworkers he thought would be a good manager, a good player. We're put on 2 case managers onto the shop floor, providing support for these young people and see what happens. And he invited me to your offices in Camberwell, and I met these 2 girls, Rashina and Antonia. And it was revelatory. I met these 2 amazing young people, young to me, who had fascinating backstories, and were quite anxious and nervous about meeting some crusty old surgeon. But despite that, were incredibly connected, incredibly perceptive, and incredibly human. And at that point, I knew it would work. So fast forward a few months to April, about 5-6 years ago, I'm absolutely bricking it. I put on these 2 people into my shop floor, this great big trauma centre, onto our emergency department, into our ward, with the expectation, and the mayor's office have said they're going to rob you, they're going to nick your stuff, they're going to groom all these children and sell drugs for them, they're going to bring criminality, it's going to be a disaster, and they're going to take your job from you. And I was taking that really well. So I sat them in there, put them into a cupboard, and panicked, expecting to get sacked. And the funny thing happened. I was talking to one of my colleagues, and mother of a child came up to me and said, like, said to me, "Sorry, mate, do you mind? I'm talking to the lady doctor," and said, "Doc, I'm really grateful you trying to talk to my son about his life, but you don't get it. But Rasheen does. And I saw the change in attitude, and more importantly, change in belief that the individuals from St Giles brought to these young people at the worst point in their lives. And these young people engaged with Rasheen and Antonio, they engaged with support, they engaged with services, they engaged with themselves. They started having conversations about their pluses, not just their minuses. They started talking about their hopes and dreams, and they engaged with healthcare professionals, they engaged with themselves. They went home with their families. And because the program goes into the community and goes on for months and months, 6 months of support, these young people started to believe in themselves. And weird things happened. First of all, readmission rate just dropped away from 35% to 1%. And a system that's been running for years with 35% readmission rate, losing that readmission rate overnight was spectacular. You have to understand very clearly, this was a life-saving intervention. A life-saving intervention. And I started getting messages from young boys about them going to school, about them getting jobs, about going out with their mum and buying them food, going to Nando's, of course, other chicken is available, but sending pictures of themselves with their mum, looking proud, having bought a meal, they pay for themselves with money they've earned from a job legally, and their mums being proud of them for being what they've done, for doing all that hard yakka. And that program had taken a young person at their most vulnerable, bottomed out their concerns, assessed their needs, found the positive and good within that person that we all knew was there, and brought it to fruition, supported and challenged, sense checked, bullshit checked, all the talk, put in place real, tangible support that actually worked, gave agency, empowerment to the young voice, gave that person the power to deliver change in their own life, to their own way, and gave them their own power. What a miraculous transformation. And to see the look in the eyes of parents of these young boys and girls was revelatory. But there's another piece, a much more powerful piece. I work in healthcare. We work in a very strict system. We haven't changed our ways in years. But to see Rosh and Antonia, and subsequently the millions of people who were there, and Samir and Manir and Rianne, I know you're here and you're all amazing. Every work we've had has been absolutely incredible, brought things to the table. What's happened is the culture of having lived experience on our ward has changed how we do business. We are truly now non-hierarchical. We listen to the voice of the expert rather than the title or the role. So if Samir said you can't go home, you can't go home. Suppose you need more work, you can't go work. And I've got the professor of surgery asking the advice of lived experienced persons how to manage this patient better. We've become truly intersectional. We have healthcare, social care, emotional care, policing on the ward in the same space, working together for common good and gaining the support of the individual inside you to build a future for themselves. And our culture of healthcare has changed. And we do our job better and more compassionately because of the involvement of an organisation that values lived experience and values content over artifice. And this is what you bring to the most challenging environments. And this is why you should be so incredibly proud of yourself, because you save not just the lives of the people you support, but you make organizations more humane, more powerful, and more effective. So when it came around to thinking about becoming a patron, it was a no-brainer. This is an amazing organisation, something I've been seen. I sit here and I bang the drum and raise money with you guys because I see what you can do. And this piece of work we do at the Royal London has been expanded to multiple sites around the country. We deliver this kind of incredible work in so many places. And this small piece of healthcare work is now running in 13 emergency departments in London and also running in the Midlands, running in Cardiff. And this practice is influencing how we deliver this care in the emergency department and in trauma services, but more importantly, how healthcare organisations value lived experience, not just in that most pointy edge part of work. It's about looking at how we support individuals who look and sound differently. So now we are looking to find that talent in our community that doesn't look or sound like a standard medical student or standard nurse, standard doctor, standard pharmacist. We look out for that spark, that inspiration, that talent in schools or outside schools. Not in school right now, but got talent. Listen, support, nurture, empower, agency. Volunteer with us, work with us, lived experience with us, widening participation with us, come into us and become our educators, teach us how to do things better. Become part of the healthcare system, be a chippy, be a painter, be a doctor, be a nurse. Give us your skill set, make us more powerful, make us more diverse, make us more what we can be, and represent our community truly in a proper, holistic, and compassionate way. And we've changed from being didactic, dogmatic, divisive, to engaging, holistic, supportive, humble. It's hard to imagine the change in 5-6 years from an organization that thought it knew everything to an organization that wants to learn everything. And that change has been brokered by you and the people you represent. Without St Giles' trust, those lives would not be transformed, those lives would not be saved, and we as an organisation would be weaker for it. And that goes on beyond the healthcare system towards advanced reduction programs that I lead and manage with the VRU in London and nationally. The work that you are doing is transforming how we support our communities and empower those communities. And you're a beacon of what is delivered, not promised, but delivered in line of sight in the worst possible times. And we've been in awful times the past 2 or 3 years for all manner of reasons. But we've stuck to our guns. We've demonstrated that this works. And we know that when we work together and listen to each other and share our experience transparently and humbly, we build a better machine that is effective, is visible, is transparent, and it works. It absolutely works. So I'm running out of time. I'm going to try and finish on a sort of high now. I'm going to try and build up to this a bit. So over lunch, right, enjoy, sit back a bit and smile and bask in the adoration from one healthcare professional to you professionals. You've helped me find a better way. You've helped me build a better system. You've helped me see what I felt was there, that there was beauty, there was power, there was a great amount of talent we weren't exploiting. And by having your workers on our shop floor, our young people who have no hope can see what can be achieved when they engage and are supported by lived experience. I'll stop there. Thank you.